Well, welcome. Uh, we have been talking about the impact of mistakes when an aging loved one travels, through a series of transitions and care. So today we're going to share a story about how leveraging a professional, such as a social worker or a patient advocate, can help prevent those potential errors from occurring. So welcome to this week's Tuesday Tips. The title of this Tuesday Tips is Leveraging Professional Support During Care Transitions. And if you're here live or catching the video replay, thanks for taking the time to spend a few minutes with us. And as we try and give you some insights on managing the care of your aging loved ones. So, hi, my name is Pam Dunwald. I am one of your nurse advocates from Your Nurse Advocates Consulting. So, kind of to recap, this month we've been talking about discussing the potential errors that our aging loved ones may incur when they're moving from one level of care to another. So these changes, like going to the doctor's office, going to the hospital, to the nursing home, to home, or to assisted living, these changes or transitions, they can lead to medication errors, errors in treatment, also loss of provider follow-up visits, as well as readmissions or extended hospital stays. So I've got a kind of a staggering statistics. According to an article that I read from Patient Safety Network, they say an estimated 60% of medication errors occur during transitions of care and lead to avoidable hospitalization and prolonged hospital stay. And so the article goes on to say that it's crucial to establish effective communication and handoffs between these teams to guarantee the accurate transmission of relevant medical information and patient preferences. So a lot of where the errors occur is due to breaches or issues with communication. So what I wanted to do for this Tuesday Tips is kind of bring this home, kind of bring it to a realistic story for you. And so we're going to share the story of Edith. Now, the different scenarios of transitions, of examples of transitions in care are endless depending on the illness or the injury, and then what levels of care that's required to bring them back to their prior status of health or to maybe now their new normal. So let's talk about Edith. Edith fell at home. She sustained a hip fracture. She was treated in the hospital, so she went from home to the emergency room, from the emergency room to the hospital floor, had surgery, stayed in the hospital for a bit, and then was sent to a rehab bed in a nursing home. So that's, several transitions. So out of the get-go, what are some potential errors that these sequence of transitions could include? So A, the hospital or the rehab unit not getting authorization from the insurance or the VA to transfer the patient to the rehab. So somebody's got to make sure, and if this doesn't happen, then the patient or the family may get an unexpected bill that they were not anticipating. And the next thing is this rehab facility, nursing home, are they in network with your insurance company? Back during the COVID days when beds were tight and they were full, insurance companies used to give, they were pretty lenient, and they would do out-of-network referrals or authorizations because there was no place for these people to go. That has now changed since COVID is done. So if the nursing home or the rehab facility that you're going to is not part of your insurance network, say your Medicare Advantage plan or your supplement plan, then you risk, incurring more costs. So who's taking care of that? How do you know that that's taken care of? Another thing is in transitioning the patient from the hospital, gaps in communication could occur, and the rehab facility may not get the correct or updated treatment and medication information. And so there's an opportunity for error there. And this is where, the Patient Safety Network is talking about the 60% of medication errors occur during a transition. Well, like we shared this example of before, if you're going to a nursing home, the doctor does his discharge summary. It summarizes the illness. It has a diagnosis, has a medication list, treatments, everything that anyone would need to take care of this patient at the next level of care. If there are mistakes in that, or if it's sent before the doctor's finished, or the doctor makes changes and updates after speaking with a nurse or speaking with a pharmacist, and that new copy is not, sent over to the rehab facility, the nursing home, okay, boom. They're not getting they're already, before the patient even gets there, they're already in the hole with mistakes. So we want to make sure that they always get the corrected and most updated information. Uh, here's comparing your list. So when you go from the hospital to the nursing home or to the rehab, sometimes, maybe depending on what medications you were taking prior to coming into the hospital, maybe because of surgery or for something else going on, sometimes those doctors in the hospital, they may hold medication, some of your home meds. And sometimes they're as simple as vitamins or supplements, but still they're often held when you're in the hospital. So if that home and the pharmacy in the hospital is they're usually, the nurses, everybody gets their hands in there to try and reconcile those medication lists from the home list to the hospital list, and then going to the nursing home, trying to compare that. But again, that's another step where an error could occur. So now, does the medication list that's being sent over to the nursing home or the rehab facility, is that missing the home meds that your loved one was on when they originally went into the hospital? So always comparing those med lists for each transition is really, really important. So another thing is, when patients leave the hospital, they usually want a follow-up appointment with their primary care provider or the surgeon, again, depending on the illness or the injury. And depending on how, severe it was, they could want an appointment anywhere from 2 to 14 days after they leave the hospital. So if they're going to a nursing home or a rehab facility, are they going to see their own doctor? If so, who's making that appointment? And how are they going to get there from the rehab facility or the nursing home to the doctor appointment? Are they going to see the nursing home doctor? Well, if they're going to see the nursing home doctor, who's going to be responsible for making sure that that patient is on that doctor, the nursing home doctor's rounding schedule in the time frame that the hospital discharging provider would like that patient seen? So here's another area of where the ball could be dropped. So weekend transitions, that can compound this. You've got different staff on the weekends. You might have changes in doctors. The clinics aren't open to make appointments. So weekend transitions, really, really to be diligent on making sure that the things get accomplished that need to get done. So let's move on now to the next transition. And so now we're at the rehab facility, and thanks, Kath, again for joining and for giving that thumbs up. So let's move on to that transition from the nursing home. So the rehab facility or the nursing home is determined that the discharge date was set and the plan was to go home. So Edith is going to have another transition. So the family and her husband, they want Edith home. She's not quite back to her normal level of activity before fracturing her hip. So the family is a little worried that she might need some extra help at home, and whether or not the husband, he's elderly as well, and can he help to manage the support that she's going to need. So family's aware of these concerns for safety, especially since their mom had a recent fall at home with an injury. So there should be a care conference leading up to the anticipated discharge. There should be regularly going on in the nursing home or the rehab facility to discuss this transition at home. You should never, ever, ever say, you know what, you're going home tomorrow. We've run out of Medicare days. If you don't go home now, you're going to have to pay privately. And unfortunately, that happens in some places. Now, this did not happen in Edith's case, so that was a good thing. The nursing home where she was in a rehab bed, they had done a fairly good job in trying to anticipate their needs. So during the care conference, we were able to talk about what equipment they may need at home. We talked about bringing home health care, that's skilled home health care. So a nurse, PT, physical therapy, occupational therapy, to help that transition to home, to see what maybe equipment would be needed, or how to teach the family how to assist and how to avoid injuries. But what if that's not enough? How do you know? What if you need extra services? So who's going to help the patient and the family achieve that? So again, who is going to be addressing all these concerns? So it's now time for Edith to go home, and she can think of nothing else but just to get home to her husband and her family, and she just wants to get out of the nursing home. So She's been in rehab for a few weeks. She's seen the nursing home doctor, and she's not been able to see her doctor who knows her the best. So now that the plan is going home, who is who's scheduling that follow-up appointment with Edith's regular doctor? And whose responsibility is that? When does she need to be seen by her regular doctor? Who's making those arrangements? So, and then again, how is she going to get there? What if things don't go as planned at home and family has concerns that Edith is not safe without more services? So the family's helping out as much as they can, but they're starting to feel the burden build up. They want their parents to live out their golden years on their terms, but it's getting harder to support their choices. So what do? Who helps them at this point? They're not in the healthcare system anymore. They're at home. They do have their doctor's office. So what can they do? Well, there's a couple of options here. So number one, you can reach out to the social worker at the clinic where your doctor is, at the hospital where you're discharged from. Oftentimes they will assist, or the social worker at the nursing home to see if they will help you. Or you can reach out to your local county aging resource office. Every county in the 50 states has one. They have different names, but basically they all do the same thing. They are a government agency that is in charge of knowing the local resources for aging adults. If you're not sure what it's called in your area, again, you can contact just the health department or ask, a social worker. They will be able to tell you the name of the facility or the name of the agency in your county. Here in Wisconsin, they're called the ADRC, or the Aging and Disability Resource Center. So one other last option you can do is you can reach out to an advocate like Your Nurse Advocate Consulting. You could reach out to an advocate like us, and we would be more than happy to be able to help you. One of the things that we can do, especially as nurse patient advocates, is we can read between the lines. We can catch potential errors if we have access to the information that we need. They don't know, family doesn't know what a good discharge plan is from a not so good discharge plan. Are the medications going home the same? That is something that they can look at. They can compare the medication list prior to going to the hospital, once they get to the nursing home, and then coming home again and comparing that original medication list to see if anything was left off or added that they didn't know about, or any other changes that can be questioned. So make sure you compare medication lists before the hospital, going from the hospital nursing home, and then from the nursing home coming home. So leveraging an advocate can also help you navigate these transitions with insider knowledge, that you're not expected to have. We are here to support you. And I think the biggest challenge we have when we talk to potential clients is they don't realize that they don't know what they don't know. So oftentimes they don't ask questions because they don't know that they need to ask questions. And so with us being so familiar with the healthcare system and being able to know what these transitions should look like and what to check for, it's a great opportunity for us to be able to come alongside you. And, being an independent advocate, that means that we serve you and only you and your family, and we don't work for any other agency. So, again, leveraging, an advocate could be a good plan for your aging loved one and for your family. So that's going to wrap it up for another Tuesday Tips. Please feel free to drop us a comment or a question. We will make sure that we get it answered for you. To learn more about Your Nurse Advocate Consulting, you can visit our website, which is just yournurseadvocateconsulting.com. Check out our free resource tab. We've got lots of goodies there for you that you can get for free. And then we'd hope to see you back here next week for another episode of Tuesday Tips. Next week, we are going to be talking about some resources to help our aging adults maintain their independence by making sure that they have access to be able to vote at the upcoming election. No matter what side of the aisle you're on, it doesn't matter. Our aging loved ones deserve the ability to be able to exercise their right to vote. So we'll share some resources on those, that maybe if your loved ones in an assisted living or a nursing home or just aging in place at home, but maybe have some mobility issues, we'll have some resources for you. So with that being said, we will see you back here at a next Tuesday Tips. Take care.